The World Health Organization says there is no reason to stop using AstraZeneca's COVID-19 vaccine. The assurance comes after Thailand and several European countries halted the rollout amid concerns that the jab may increase the risk of blood clots.
Erring on the side of caution, Thailand has put the brakes on the country's AstraZeneca's COVID-19 vaccine rollout, following the footsteps of several European countries. Denmark, Norway and Iceland suspended the jab yesterday after reports of the formation of blood clots among those who had been vaccinated. But health authorities have stressed that the decision was a precautionary measure and there is no evidence of any causal link.
วัคซีนของ AstraZeneca เนี่ยไม่ใช่วัคซีนที่ไม่ปลอดภัยนะฉีดไปแล้วทั้งโลกเนี่ยประมาณ34ล้านโดสมีผลข้างเคียงบ้างนะครับแต่เมื่อไหร่มีผลข้างเคียงซึ่งเขากำลังมีการสืบค้นอยู่เราเพื่อความปลอดภัยของประชาชนเราต้องรอฟังซึ่งก็เพียงแต่ชะลอไปผมคิดว่าเป็นสัปดาห์อย่างมากก็ 1-2 สัปดาห์ถ้าผลออกมาแล้วถูกต้องนั่นยิ่งสร้างความมั่นใจว่าวัคซีนที่เรานำมาฉีดให้ประชาชนนั้นได้รับการยืนยันชัดเจนว่าปลอดภัยเราถึงจะนำมาฉีดให้กับประชาชนของเรา
Thailand's decision to pause the AstraZeneca rollout also led to a late cancellation of a televised jab for the Prime Minister Prayut Chan-o-cha. He was supposed to be the first person in Thailand to receive the jab, but instead, the media were greeted by empty chairs. Thailand has imported at least 117,000 doses of the AstraZeneca vaccine. So far, at least 30 blood clot cases have been reported among the 5 million people vaccinated across Europe. While there is still no established link between the vaccine and blood clots, several countries like Austria, Estonia, and Luxembourg have paused the use of a specific batch of vaccines. The safety concerns are a setback for AstraZeneca, which has faced production lags and a bumpy rollout in Europe. The vaccine has also faced resistance in countries like Germany, as it has a lower overall efficacy rate compared to rivals like Moderna and Pfizer-BioNTech. More than 70 countries have approved the AstraZeneca jab. So far, the UK has administered over 11 million doses of the vaccine.
Mae Wong joins us live for more on this story. Mae, it's not the first time there's been a delay for Prime Minister Prayut to be vaccinated.
Well, about 2 weeks ago, before the first batch of doses arrived from China, that is the Sinovac vaccination, Mr. Prayut said that he would be glad to be the first to get that vaccination, and he was ready for it. Only then to be told by the doctors here in Thailand that he's not eligible for it simply because he's over the age. He's 66 years old, and the efficacy test done for that particular Sinovac vaccine was only done for people between the ages of 18 and 59. So he didn't qualify for that. Instead, the Deputy Prime Minister and Health Minister, as well as 5 other ministers, took those vaccinations. And obviously, Mr. Prayut had to wait it out. Now, 2 weeks later, with AstraZeneca, he was supposed to have taken that dose on Friday, today. And again, he didn't turn up because last night, the Deputy Prime Minister Anutin Chanvirakul actually made a phone call to Mr. Prayut telling him about the new reports of these blood clot cases over in Europe, and therefore told him not to turn up for the vaccination that was supposed to have been done this morning. So herein lies second round where he will not receive that vaccination and will have to wait it out. Now, obviously, you've got a lot of the opposition MPs that are very quick to say that how can a leader of a country not be the first to take the vaccination, given how this does not bolster confidence for the vaccinations here. But the Deputy Prime Minister, as well as the Health Minister, Mr. Anutin, said it's always better to be safe than sorry. And that's the reason why they held a news conference earlier to explain exactly why they didn't go ahead and push through with the AstraZeneca vaccinations.
พอมีเหตุการณ์ที่เราควรจะต้องพิจารณาให้ละเอียดรอบคอบแล้วก็เลื่อนไปนะครับนี่คือความมั่นใจที่พี่น้องประชาชนได้มั่นใจครับว่าเราไม่นำความเสี่ยงมาให้พี่น้องประชาชนแน่นอนและยังมีเวลาอีก3 เดือนสำหรับพี่น้องประชาชนในการที่จะรับวัคซีน AstraZeneca.
Mae, how will AstraZeneca's delay affect Thailand's vaccine rollout plans?
Thailand is determined and is confident that it will not affect its rollout plans. In fact, today at the news conference, they mentioned time and again that it will have no impact on its plans, given the fact that the scheduled rollout for the AstraZeneca vaccination will only come later because the scheduled delivery will only happen in about 3 months. And that's the reason why they still have time to wait it out, to perform investigations, wait for the reports of what is happening in Europe to come to Thailand before they make any decisions. Also, they mentioned that Thailand is a low-risk country. At this point in time, it only is seeing about 26,000 COVID-19 cases with only about 85 deaths at this point. So they feel as though there is no real emergency to roll out the vaccinations as soon as possible. And obviously, Thailand also said that they have Sinovac, China's vaccination, that will help them and stand them in good stead. At the end of this year, for 2021, Thailand is expected to have 63 million doses, and a larger portion of them will come from AstraZeneca. But obviously, the health authorities really try to make it a point that it will not impact any of the vaccination rollout, because as of 2 weeks at this point, well, as of Thursday, about 40,000 people have already received the inoculation, starting with obviously the frontline healthcare workers and also moving on to the other hospitality workers, for example. So all of this, the health authorities are assuring the people of Thailand that they will not be affected by this. And more importantly as well, they say that they want to make sure that everything is safe and ready for all. But the opposition MPs, once again, quick to say, why did Thailand place all its eggs in one basket in AstraZeneca, and why did they not branch out to have other vaccines from other countries and other manufacturers? So we'll see whether or not Thailand in the next couple of days, in the next couple of weeks, will be able to shed more light on whether or not when Mr. Prayut will be able to take that vaccination and how much more will they be able to roll out in the near future.